I'm Val Clare. I'm the Deputy Chair of Birmingham Solihull Mental Health Trust. I'm also a non-exec director at Coventry and Warwickshire Partnership Trust. And I'm also here as a council board member of the University of Warwick. And finally, I am a leadership member of the Apna NHS team. It's been phenomenal from very, very small beginnings to where we are now. Just looking at it today, we've got more delegates here today. Our speaker list is as strong, or if not stronger, and growing. We're actually seeing a difference where people are actually coming to us and saying, wouldn't it be great if I could be invited to come along and speak at the conference. So that in itself speaks volumes. And I think the other difference is that we're beginning to have a say and making an influence and making a difference in some of the policy making, albeit very small steps, but we're having a say in some of those key decisions that will shape the NHS going forward. I believe conference is going to be really important in terms of shaping some of those decisions. The only way we can shape decisions is to share information, share experiences, personal experiences, experience of our colleagues, experience of our patients. And unless we start to share that in a much wider concept and a wider perspective, that then gives us the ability to actually get a much better data set, much better level of experiential feedback, which will help base some of our decisions in a much more grounded and an effective way that we can actually then really make tangible differences going forward. And I think doing it within in the isolation of an NHS trust isn't necessarily it's fine. You can look at your patient cohort and your staff cohort, but getting a much wider perspective. And as you've seen today, we're going to have input from GPs, from primary care through to secondary care, mental health, social care is represented as well. And so it's a whole spectrum of all of the players that actually contribute to the well-being of our population. The Apna Awards were pulled together purely to celebrate South Asian achievement within the NHS and beyond. So we don't just look at our NHS cohort and our NHS colleagues, but who else is helping to sort of contribute towards the health and well-being of the population. And we spoke about this at conference earlier today, and all of our speakers are saying that we cannot achieve a better outcome in terms of population health and remove inequalities alone from within the NHS. It has to happen through partner working, through engaging the voluntary sector, social services, local authorities, the third sector, all of those players who contribute towards the population health and removing inequalities are really got to come together and take that whole agenda forward. And really, the awards are epitome of celebrating that and celebrating the achievements of individuals and groups of individuals who have worked really hard to sort of work on health inequalities.